Thanks, Tom. That was really a great presentation. We might move right along. If you do have some questions for Tom, you might want to put them in a chat and we'll try and get back to them a little later. Raglan Maddox is up next. He's going to be talking about the impact evaluation. Raglan is the study director for tackling Indigenous smoking at the ANU. So welcome, Raglan.
Thanks. Can everyone hear me all right? Yeah, Tom's nodding, so I'll take that as a yes. And nice to see everyone again, although it'd be much nicer to be able to see you all in person. Yeah, I guess, and I think some of you have already seen a lot of what I'll talk about today, so I might try and speak a little bit to some of the challenges around the remote data, but I know we spoke about in Perth at the beginning of the year, in February perhaps, and try and explain, I guess, what our team has been up to since then. And before I begin, I did just want to acknowledge the Ngunnawal and the Ngambri people on which the lands that I'm on today, and pay my respect to elders past and present. As most of you know, I'm from Milne Bay in Papua New Guinea, which is sort of the southeast tip of PNG, and I just wanted to share this photo with you all, although, like Tom was saying, obviously I can't return there for a little while and basically not allowed out of Canberra at the moment, so relatively quiet in the office. But if we, when we do get an opportunity, it'll be nice to go back, and so there's sort of a postcard for those of you that are interested. So great fishing there, and I look forward to also visiting Perth and WA when we get the chance. So who are we and what am I talking about today? I did want to talk about a little bit about the impact and outcome evaluation that's progressed a little bit, and we've spent a lot of time progressing some of the administrative aspects since COVID-19 has sort of changed our program of work at the moment, similar to everybody else's, I'm sure. But we're a team led by Aboriginal and Torres Strait Islander researchers, and Tom mentioned before that, before you mentioned Ray Lovett, who's my boss, and some of you might be aware of the Mayi Kuwayu study. I know SWAMS and Derval and a few others are partners with us in that research, which we are looking at, including exploring some attitudes and behaviours around smoking over time. We also partner with, we're also co-led, I should say, with Menzies School of Health Research. So Tom mentioned David Thomas before, who I understand will be joining later on. He's also a member of our executive and a PI on this work, and working with a number of organisations around the country, including the National Best Practice Unit and Quit Victoria, Circa and others to undertake this work. So what do we want to answer, and why are we doing this? As Tom mentioned before, particularly I think with the impact of COVID-19, there are always opportunities to improve our work and also to justify or better understand the work that we're doing and the impact it's having. So we're trying to understand what works to improve health and well-being. And there are a number of ways or principles that sort of underpin our program, including Indigenous leadership and governance, Indigenous data sovereignty principles. All of our work is community-driven research, informed by and with our community partners, as well as our governance board. Oh, thanks, God, Ben's beating to the punch and sharing all these links before I even get the chance. So very efficient. Thanks, Ben. And we look at a strength-based approach, and I think I've spoken about this probably the last couple of times I've met with all of you around really trying to highlight the things that we're doing well and celebrate those successes, as well as also improving some of the areas where there are opportunities to improve them. We also use mixed methods, so not just quantitative research, but also qualitative research to better understand the context and the work that is being undertaken. and there's a photo on the right-hand side there of the Aboriginal and Torres Strait Islander Health Program team, including a little dog down the front right, which is sort of a trick that not many people pick up on. For those of you who aren't familiar, we do have a governing body or an advisory group, Titu Thame, which is Ngunnawal language means to share knowledge. And I think that's sort of one of the underpinning principles of the work we're doing is to improve access to all the data that is actually being collected through administrative data sets and other data sets across the country, and to unpack that and better understand it. So I'll try and focus, well, I'll try and spend a little bit of time explaining what I mean around rural health and remote health, which Tom sounds like he gave me a little bit of homework there. As I mentioned, we do have a number of partners. We're funded by the Department of Health, so Trudy's team, and the program exec includes Ray Lovett, Jill Guthrie, David Thomas, Katie Thurber and myself, and I'm the evaluation lead. And then there's about 6 or 7 of us at the moment, as well as a number of Master of Applied Epidemiology students that are looking at different aspects of the tackling Indigenous smoking program and the impact that it's having, noting that it's not just prevalence that we're looking at, but a whole range of indicators. I'll go to the next slide. Sorry, my computer's a little bit slow at times. So what are we trying to answer? We're trying to get a better understanding of the vast impacts that the Tackling Indigenous Smoking program is having. Have smoking-related outcomes improve faster in areas where the Tackling Indigenous Smoking program has been rolled out in comparison to areas without Tackling Indigenous Smoking funding. And as I mentioned, we're not just looking at smoking prevalence, but also looking at quit attempts, people who have successfully stayed quit, delays in uptake. Have there been changes in behaviour, so increased calls to quit line, delays in initiation, which I mentioned, increases in, for example, smoke-free policies, reductions in secondhand smoke exposure, so on and so forth. So really trying to understand a very comprehensive picture that we might not necessarily get if we just looked at prevalence. I think Tom probably articulated this quite nicely before about why we need this evidence and the ongoing need to understand what impact that the Tackling Indigenous Smoking grant recipients are having. And I think you've all shared some insight with me over the last, I guess, 9 months or so since we first met about different impacts that we would expect to see. When I came out to WA and we had the first meeting in February, I outlined our original intention around defining boundaries and understanding what activities have been taking place. And so thank you for the feedback and the discussion from that. Obviously, since then, the world is a little bit of a different place. And so we've had to try and shift some of our work online so that we can continue doing the mapping and boundary exercises and understanding what's going on, but using tools like Zoom, for instance, to understand that. We're analysing existing data sets, as I mentioned, and we have access to about 8 different national data sets at the minute, including Australian Bureau of Statistics data, national perinatal data set, the Pharmaceutical Benefits Scheme data, so looking at NRT and other impacts. We're looking at quitline data, as I mentioned, and a number of others. And we're also looking at Mayi Kuwayu data, which I'll speak about in a minute. And at the end, or towards the end of the evaluation, we'll bring all of those findings together to report back on sort of a whole, a more comprehensive or a whole of population sort of perspective to look at all those different impacts that they're having. And I guess part of the engagement process is to find out what is useful for tackling Indigenous smoking teams and communities to see what sort of knowledge translation products or communications you'd like from us. So you would have seen my contact details at the front and also at the back end of this PowerPoint, and I'll make sure that that's available on TISRIC as well so that people can contact me if they don't have my details already. This slide around defining the boundaries sort of highlights some iterations. So the first map there is the language map. It's then followed by the sort of 2010 Tackling Indigenous Smoking boundaries, which would have covered 57 regions in the ACT. And then at the moment, that last map is the iterative map that we're going through and piloting a Tackling Indigenous Smoking program intensity tool. And please let me know if you're interested in participating in this pilot, and I'll explain a little bit about what the intention of this pilot is doing at the moment. And so the main goal of this pilot is to understand what types of activities have been taking place in what geographic area, the intensity, so how frequently activities are taking place, and what the sort of reach is. So what numbers are we looking at? What's the population that we're reaching? And the intent of this is to understand what we should be looking for and to find out what the impact is. So for instance, if there's been a focus on smoking and pregnancy, should we be seeing a change in smoking prevalence or smoke-free policies among women of reproductive age? If we're targeting children and young people, will we see a change in behaviours around uptake or around smoke-free homes or around education programs in schools, so that we can better understand the impact that the program is having. Part of this, and I sort of spoke about prevalence being a relatively blunt indicator. So if we look at smoking prevalence since 2004, we can see a relatively steady decline, both among males and females. I also recognise, and if we think about this map and the variation across Australia, not only is Australia diverse, but we do have different infrastructure and different needs and behaviours and attitudes and all that sort of thing, both across the country but also within regions. So trying to understand that nuance is extremely important. Tom shared a similar slide, I think a red and green one, around some of the variation across urban, regional and remote Australia. Again, when we look at this slide, I think it looks fairly stark, and so yes, you can see variation in urban and regional Australia in comparison to remote Australia. But there is actually more nuance to this discussion as well. And so when I go to my next slide, we can actually see when we start to break that down by age group that we are seeing differences in uptake. And I should actually flag that this slide is actually representing daily smokers, and so the challenges around daily smokers is quite different to non-daily smokers or current smokers as well. So it's important to remember this and to think about, and I think David Thomas might speak about some of the variation with people changing their smoking behaviours, particularly in remote Australia, where they might be stretching cigarettes further, where they might be changing the amount of tobacco they're putting in roll your own cigarette and things like that. So it's not necessarily a simple linear line like this, but there are nuance and changes in that. I think it's really exciting, particularly if we think about the young population profile of the Aboriginal and Torres Strait Islander population, that we can see that there have been declines, particularly significant declines in those aged under 35, and then we see variation throughout the other age groups. It's also important to note that there have been significant improvements in mortality rates in older age groups. So we have seen a decline in mortality among older populations. So the 55 and above, it's worth noting that people are living longer, and so we might actually be seeing healthier people continue to live, and those smokers sort of pushing up into the older age group. So I guess I just wanted to stress that while the ABS and some others have sort of highlighted this as a relatively negative story, there is actually a silver lining to it, and I think we can start to explore and unpack this, and that's part of the work that we're doing. I should also flag, and I think I've mentioned to you at the jurisdictional gatherings that we've had, is that we do have an opportunity to provide feedback that might be more relevant to your area. So if, as we go through the intensity tool, we can actually try and map out regions or smoking indicators that might be of interest to you and then report them back if possible. So for instance, if we're able to look at WA or if we're able to look at the wheat belt specific information, we can pull information out from, say, the ABS or the National Perinatal Data Set and some other things that might be particularly useful and of interest to you. And so we can talk about that offline. These are some of the data sets that I sort of mentioned before that we're looking at. Again, just trying to get an overall understanding of what we know is happening in communities, what communities have been telling us is occurring. And again, I guess each of these data sets, it's important to note, have strengths and limitations to them. So the more we look at it, the better understanding we have. Did someone have a question or anything? I think I may have heard either that or I might have just been getting some feedback. But if anyone has anything to say, feel free to stick up a hand or type something in the chat box. So all that to say, since 2004, we've seen about a 10% reduction in daily smoking, which equates to about 50,000 fewer daily smokers today than if the rates had stayed the same. And obviously many, many lives have been saved. These are some examples of sort of the analysis or trajectory that we would expect to see as we're going through this process. So Tom mentioned that the Tackling Indigenous Smoking program or iterations of that have been implemented since 2010. And so we would expect to see, say, for example, decreases in parents smoking around children or mothers smoking during pregnancy or delays in uptake. So there's a whole range of indicators where we'd expect to see some change. I mentioned the Mayi Kuwayu study before, and thanks for sharing the link. I'd encourage any of you who haven't completed the study or participated to look at that. It's essentially an Aboriginal and Torres Strait Islander-led study exploring well-being and centering culture and well-being at the middle of that, and looking at how it can improve health and well-being. So looking at a whole range of things, including access to land, foods, language, all that sort of thing. And it's, I should actually update this. I feel like I said that last time, but we've had now over 10,000 participants, which is incredibly exciting. And we're currently looking at doing a follow-up survey, which is under revision at the minute, and looking at having a couple more questions around smoking. I mentioned that we are, well, there are different aspects to capacity building. One of the things that we always do is return results to communities. So wherever possible, we'll provide feedback to communities on relevant data sets that we sort of get access to. And so hopefully there's some really useful information there for service providers, partners and communities. We also recruiting, train, support Aboriginal and Torres Strait Islander staff and students. So I think at ANU we're the largest group of Aboriginal and Torres Strait Islander staff and students. And I think there's probably about 10 Aboriginal students either doing Masters or PhDs here with us at the moment. Not all of them in smoking, but all related to smoking, more or less, in terms of there are different aspects to it. So looking at the impacts of colonisation, the impact of access to health services, impact of rape, tobacco. So one looking at variation across urban, regional and remote Australia, and the other master's student is looking at the quality of ABS data, essentially. And then we have a couple of students looking at Mayi Kuwayu study data. I think I already shared this with you, but just in case anyone missed it, we did publish a review of tobacco use among Aboriginal and Torres Strait Islander people recently, and there's a summary and a fact sheet and a video that's also attached. If anyone else has or would like to see any other sort of knowledge products come out of it, please let me know. I know we're currently speaking with Health InfoNet about doing a podcast as well, so there are a few different ways that we're trying to share some of that information. And this is the last slide, which is just if anyone would like to participate or or provide feedback on the pilot of the tackling Indigenous smoking intensity tool, then please let me know. And then I guess hopefully that sort of wraps it up. But if there are any questions, also please give a shout out. And I trust everyone could hear me. I feel like no one gave me any feedback, so I'm going to take silence with it. Nice to see you, Jana.
You're good.